Hello and welcome. Brazil's President Bolsonaro is facing the biggest crisis of his time in office after the heads of the Army, Navy and Air Force all quit as the pandemic rages through the country. The unprecedented resignation of the defence chief is being seen as a protest at attempts by Mr Bolsonaro to exert undue control over the military. Brazil registered 3,780 COVID deaths in the last 24 hours. Now, this is a new record in the country, which now regularly accounts for about a quarter of coronavirus deaths worldwide on any given day. That is more than any other nation. In total, nearly 314,000 people have now died there. That is second only to the United States. Mark LaBelle has the latest.
Getting vaccinated in Brazil takes on a new urgency, with overcrowded hospitals and a record death rate haunting the country right now.
It's very difficult what we are going through, but God willing, it will all be all right in Jesus' name.
But while receiving the jab brings relief for some, there are many now openly questioning what is going on in the president's name. From his lack of vaccine diplomacy, which has denied the country crucial vaccine supplies, to his fighting of lockdowns across the country in the courts. An approach his defense chief Fernando Azevedo apparently found hard to stomach. His surprise sacking on Monday may explain why, in an unprecedented move, the commanders of the Army, Navy and Air Force have all resigned en masse. Their replacements haven't been announced yet, but the new defense minister has, and with it, speculation that this major reshuffle is more to do with politics than the pandemic. With the popular former leftist President Luiz Inácio Lula da Silva cleared of corruption charges to challenge President Bolsonaro in October 2022, the president appears to be keen to free up posts to install loyalists in anticipation of possibly stormier times ahead. But with hospitals overwhelmed, including these queues for intensive care units, and the death rate up in the country, will the president be able to regain control of his domestic politics amid his country's current struggle to contain the global pandemic? Mark LaBelle, BBC News.
Let's go live now to Hospital Santa Casa de Sao Paulo and speak to Dr. Danilo Maksud, who is a cardiologist working in intensive care throughout this pandemic. Doctor, thank you very much for taking the time to talk to us. Can you explain the situation in the intensive care in your hospital and in others throughout Brazil?
Yes, good afternoon, Lucy. The situation in hospital is still very critical. ICU beds, infirmary beds are overcrowded, and many people looking for help in emergency rooms. As I said before, there's no scientific data on age group of those infected, but we observe a much younger population compared to the first wave of the infected, and faster clinical deterioration too.
Has the health system in the country collapsed?
Yes, I can say for you that we are collapsed.
What do you need most right now?
I think that in the next few days, probably we will need more ICU beds. We will need more people capacity to work in ICU beds. And I'm afraid that we don't have this kind of people here.
How is your staff coping? How are medical people throughout the country managing with this kind of pressure?
Yeah, we are living exhausting routines from physical and psychological point of view. Try to contain the emotional stress of the health team. At the same time, that we need to maintain the balance to treat these patients who are very serious.
Doctor, what do you think of President Bolsonaro's handling of this crisis?
From the beginning of the pandemic, it was not taken serious by the federal government. A total lack of recommendations and a lot of fun was done about the disease and the possibility of many deaths. And now we are in this alarm situation.
So now that we've seen all of these defence chiefs step down and this real political crisis brewing, do you think things are going to change?
I don't know. For me, the fact of happening yesterday about the resignation of the heads of the armed force there is very symbolic. We had a recent military government that was established after a military coup. and it was exactly 61 years ago, in March 31 of 1960. I think this shows that the High Command of Brazilian arms are on the side of democracy and distance from the authoritarian nature of the government of the federal government. I think that's the biggest military issue we have since the beginning of 1977.
So a huge moment politically as well. What's happening with vaccinations in the country? Are people confident in vaccines, or is there some hesitancy?
There are two vaccines here, manufactured locally, but we import the raw material. With the lack of raw material and the lack of the other vaccines, I think that we have not vaccines at all. We are vaccinated only healthcare workers and the elderly people from 17 years old, and we don't have vaccines for all Brazilians.
Doctor, if things continue like they are now, hard for you to imagine, I know, since you're so exhausted, but what is your greatest fear?
If I can have to choose who will live.
That is a very sombre and sad choice for any doctor to have to make. Thank you very much for joining us and giving us some insights into what your life is like right now and in the country too. Dr. Danilo Mixer joining us from Sao Paulo.